My name is Ursula Philpott. I'm a dietitian and I work on the long COVID pathway for staff members. We sit within the Primary Care Wellbeing Service within Bradford Primary Care Trust. So today I'm going to do a small brief video just with some top tips here around my sort of practical tips for your rehabilitation and recovery from long COVID. So my first tip would be vitamin D. Please go and get your vitamin D status checked. Most of the country have low vitamin D levels. We don't have enough in our diet and we don't get enough sunlight. So even without having a disease like long COVID, you'll be likely to be inadequate in what you're having. So we know that spending time indoors and having a disease can mean that you just don't have enough vitamin D around. So it's really important to get your blood level checked. You can buy an over-the-counter supplement for vitamin D if you go to a normal pharmacy and ask the pharmacist. But sometimes if your blood levels are very, very low, that's not adequate in bringing up your levels to something, much nearer to normal. So we would really advise you to go and ask your GP to get that checked. On top of that, there are some other vitamins and minerals that are really, really important and can become quite low when you've been unwell with something like COVID. So check with your GP if they can check for folate, vitamin B12 and iron as well. So all of those need checking. So that's my number one tip. My next tip would be to work towards something called Mediterranean diet. So Mediterranean diet has lots and lots of positive aspects, one of which is that it has an anti-inflammatory effect on the body. And we know again with long COVID that inflammation is one of the problems, and we think it's linked to ongoing COVID symptoms. So we want to try to reduce the inflammatory reaction in the body, and Mediterranean diet is one way of doing that. Mediterranean diet also has benefits for things like type 2 diabetes, coronary heart disease, high blood pressure, etc. So it's really important to try to move towards that diet if you want to try to have an impact on some of those disease states that can contribute to long COVID. So what does that mean? Well, it means having a few more of things, which is the good news. So it means having more fruit and some vegetables in your diet. It means using more olive oil. It means adding nuts to your diet on a daily basis. And it means having more things like legumes, which are beans, peas, pulses, chickpeas. It also means adding things like that are anti-inflammatory, such as spices, such as turmeric, for example. So adding sort of anti-inflammatory spices and herbs into your diet as well. So moving towards a Mediterranean style diet, those are all some of the positive things you can do. Some of the things that we'd ask you to reduce in your diet would be white flour products, meat, and the usual sort of sweet treats and fatty treats, the social foods that people have. So my third tip, as part of Mediterranean diet and in part of a targeted anti-inflammatory sort of dietary intervention, we'd be suggesting that people increase their levels of omega-3 in their diet. So omega-3 is a particular fat that you find in the diet, and it's only found in oily fish and some algae, interestingly, but it's something that we tend to not have enough of. And if we can increase it in our diet, what the research shows is it can have what we call an anti-inflammatory effect. So the message here would be to have a higher fish intake of oily fish. So between 2 and 4 portions a week is what you're looking for. And those oily fish are things like herring, mackerel, pilchards, and salmon. If you're unable to take fish, or you're vegan or vegetarian, then you can buy an omega-3 supplement. So the fish oil omega-3 supplement that says a high strength omega-3 1,000 milligrams is the one we'd be recommending to take daily. If you're vegetarian or vegan, there is an alternative algae-based supplement that you can take. My last tip of the day is really around loss of taste and smell, which often hits people with long COVID. So if you can't taste things or smell things as you once could, it's really thinking about increasing the textures and the heat in your diet, because you can still detect changes in heat and you can still detect changes in texture. So making diet as interesting possible. So for example, combining smooth and crunchy foods together, combining hot and cold foods together. And I guess it's also just thinking a little bit about trying foods that you wouldn't normally like, you know, trying foods that are outside of what you would normally enjoy. So stronger cheeses, for example, extra mature cheeses, you know, meats that are smoked, maybe you know, trying coffee if you usually have tea. So it's really thinking about including a wider range of stronger flavours in the diet that you perhaps wouldn't normally. So those are my top practical tips for you in terms of diet changes that we'd be recommending. So thank you for listening today, and I hope you've enjoyed those tips.